Welcome back, everyone. I do want to mention that the Covering Wisconsin Immigration Eligibility webinar is going to be on October 15th from 1 to 2:30. I will have more information about how to subscribe to our listserv most likely tomorrow or on Friday. Next, we have Adam Van Spinkeren, who is the Navigator Program Manager at Covering Wisconsin, and he will be presenting about healthcare.gov applications and providing a walkthrough of the application. I'm going to hand it right over to Adam.
Great. Can everybody hear me okay? Am I in the main stage? Okay, cool. I got some nods. I've got an awkward setup right now where everything is kind of inverted from how I would like things. So if you see me looking in a random direction, that's probably why. I could kind of fix that in the meantime. But yeah, my name's Adam Van Spankeren. I assume we have a lot of new assisters with us. Some of you I probably know, many of you I probably don't, and I hope that's the case because I always like to have the new crop of enrollment assisters, navigators, CACs joining us to help give you guys what I feel is the best information, as best I can do anyway, and educate you on how best to actually do this work. You may or may not be feeling burnt out after the first few sessions. That's kind of how it goes with OCI and DHS. They just have a lot of information, right? It's a lot of information that you need, and honestly, it's really great, and it's really great to do the pre-licensing this way. But what becomes the most relevant kind of falls into place later on when you're actually doing this work. So that's what I want to talk about this morning: is actually doing this work, what an enrollment appointment looks like, and actually navigating the healthcare.
Oh, it looks like we may have lost Adam here for a minute. We are going to do a little bit of troubleshooting. Sorry about that. We are still working on it. All right, looks like Adam is back.
Apparently, I also got a call from Elena, who is providing excellent tech support. So I'm going to try to close that out. Can you guys hear me?
Yes.
Good. That was apparently there's a button. If you hit it, it decides you need to optimize all of your settings right away. So hopefully we don't do that again. But that's okay. We will get chugging along here right away. I'm going to share a few slides, and then we are actually going to go through the healthcare.gov application as best we can. And I do think, Elizabeth, I was about to intro myself a little bit just so people know. The Navigator Program Manager, as you said. But before that, I was at Department of Health Services, helping roll out the ACA. So I have a lot of knowledge about access, which I'm sure you guys will hear quite a lot about this week. And before that, I was at ABC for Health, kind of learning the bones and the history of this work we all do. So I'm going to go ahead and share some slides first, and then we'll dive into the application itself. And I believe, Elizabeth, you probably told everybody just use the Q&A.
Yes. Yep. We've been using the Q&A.
Okay.
So they can put their questions in there, and we will get what we can answered.
Fantastic. We'll do it that way. And then, yeah, if at any point, the application is kind of a rolling train once you get going. So if anything looks good for a stopping point, don't, Elizabeth, you know me, don't hesitate to interrupt me. We could go on any tangent and nobody's after us. So hopefully we don't keep people longer than they want to stay. But we also don't have to butt up against the next presenters. So that's great. Okay. So I share. You guys can see that. And if I do start slideshow, figures. And I need to reverse my monitor and screen, even with the tech support. That's okay. All right. All right. So we should be good. You guys can see that? Did the same thing. That's okay. I'm going to go off camera just so I don't need to worry about where I'm looking, just so I can do this more efficiently because it's not going where I want it to, and I'm not going to waste anybody's time. All right. Let's go ahead and start fresh from the beginning. Okay, so assistor appointments and healthcare.gov application. So you are all hopefully going to be enrollment assisters, and we'll talk about what that means and go over some best practices and talk through the actual application for healthcare.gov. Now, it may seem daunting, but try to remember as we go through it that this is what consumers who are on their own experience, and perhaps those of you who have had to do this yourself have experienced already for yourself, and you don't. I really try to put that hat on and remember who I'm working with whenever I'm doing this work because it really informs how we talk about this stuff, what people's main considerations are, what their concerns are, and just how complex this information is that isn't really taught to anybody outside of the roles that we all inhabit and work in now. And we'll do Q&A at the end, although again, throughout is totally fine with me. So we'll talk through the core tenets of enrollment assistance. I hope that these are pretty straightforward, but it does bear talking about and bear repeating because you will interact with consumers in many different ways, in many different forms, even before that initial appointment. You might do events or outreach, or you may work in a clinic and encounter people before you talk about health insurance. And those things that I hope are self-explanatory and don't are maybe baked into who you are and why you do this work are dignity and respect. So treating everybody the same, or maybe even better than that would be equitably, right? Meeting people where they're at, giving them what they need, letting them speak and hearing their story, letting them be who they are so they can be comfortable in that appointment. And we'll talk a little bit about the rapport that enrollment assisters develop with consumers in a little bit here. But really just acknowledging everybody, as a human being and acknowledging that this stuff is complicated and they are not alone in this. Once they've gotten to an assister, to a CAC, navigator, agent, then so much that they don't even know in terms of good and benefit has already been achieved just because we are now in the position where we can help them. They have avoided so many other barriers and navigated so many other complications to meet with us. So we've got them and we are fortunate for that, and they will be as well.
Adam, I'm sorry to interrupt.
Yeah.
Your slides aren't in full screen mode.
That's strange because they are for me. Um, very interesting. It's all right. What happens if I reverse this? I can see what you see now. Okay. Current slide. Interesting. Elena, does it change? Do you have any control over what screen is showing? Because it's really only defaulting to the one.
I do not. Can you click on the little icon that's next to the Zoom in the bottom right corner?
Bottom right corner of the main screen here.
Yeah, do you see the Zoom at the very bottom right corner? The icon that's
No.
directly to the left of it. It's where your mouse is. Yep.
Right there.
Nope. Over one more. That one. No, not the Zoom. The icon next to it.
This one.
No, the icon to the left of the Zoom.
Does that do it?
One should have done it. Can you go to your slideshow tab at the top? And then, let's see, you do have presenter view undone. So let's try, we're going to try screen sharing from the start again.
Did that do it?
I'm going to end your screen share, and then we're going to have you go full mode then, and then you'll screen share again.
Okay, sounds good. Mm, Good. Okay, I see a nod. Cool. All right. All right. Well, hopefully that's a little bit better. I think I saw the issue, so I can hopefully inform another presenter because I see there was an option to present slideshow or present the actual window, and the slideshow is what people want, I assume. Sorry about that, folks. So we'll talk about active listening. Active listening is really a combination of hearing what people are saying, repeating it back to them, letting them know that you are hearing the concerns, the things that matter to them, and while you do that as an enrollment sister, you're also picking up on the things that you know you need to do the application or to help determine what eligibility or benefit they need, whether that's Badger Care or a different Medicaid program or healthcare.gov, or maybe there's job-based insurance or other information. The thing about active listening is they don't know what's the most important information, and you also need to let them tell their story. So it is a balance that you will learn to strike doing this work. Literacy and health insurance literacy. If you see any of our materials, which by now you probably have, you know that we have a great communications team that produces a lot of health insurance literacy materials that take things like premium copay, health insurance terms, deductible, and break them down and make them easily understood by everybody out there, because these aren't words that come up frequently outside of insurance. They're not things that you learn in school, so we're educating as we do this, and that also same thing with literacy itself. Just even if you take the health insurance piece out of it, we're explaining as we go. The application's going to use words that people aren't super familiar with, and people are going to ask. Hopefully, if you have that rapport, hey, what does that mean? I don't understand, and that is okay. That's what you want to hear because that is an opportunity to educate and help people take more ownership over their health insurance and really understand what you're doing. Checking implicit bias. We will actually cover this during a main session, which is great. Another one that I'm doing with Tina Marshleck. So we don't need to talk about it too much here because we are getting a little behind thanks to technical issues. And then don't waste effort. Get information first. We'll talk about that quite a bit here. So best practices, a lot of it comes down to that last bullet point that I wanted to cover. There's communicating with consumers before the appointment. You want to make sure that they have things with them. So income information, maybe residency or their ID. Make sure they know their social security number, have that information for the different people in their household. All of those things, if you have a chance. Some appointments are scheduled and the turnaround time is very quick. They may or may not have everything they need, but it's going to save you and also, very importantly, the consumer time if you've gathered all of that info before you actually do the appointment. Introducing yourself, developing a rapport. This is something that seems super basic, which makes a ton of sense, but it's really interesting the ecology of the enrollment assistance work that we do, because two things. One is fairly new, and one is very old. One is people want help, right? And they are ready to tell their stories. They are ready to share their experiences, and they want somebody to come in and make it make sense. They want somebody to help them through this process and get them insurance, fix whatever the problem is. So they're often very eager for help. The flip side of that is now, especially since COVID, we exist in a space where we're doing a lot of this work over the phone or online, and there are a lot of bad actors out there who are quite good at developing a rapport with consumers, and we need to distinguish ourselves from those bad actors and let them know that, okay, we aren't charging anything, our help is free, it's objective, we're not steering you into anything. And that is the next pillar here, is collecting consumer consent. You may or may not have seen the consent form that Covering Wisconsin uses. We share with our subcontracts. Your organizations may have your own, but healthcare.gov, CMS, they mandate that we collect consumer consent. And what we're doing is collecting consent to look at and assess people's personally identifiable information and to help them navigate plans. We're not picking a plan for them. And when we explain what we're doing, and most people, it's one of those forms where they just want to sign it and get into the appointment, which makes sense because, I mean, as a consumer, I understand that wholeheartedly. But what we're really doing is making sure that they know that we are an objective, unbiased helper, and everything we do is going to be free, and that we're not going to do anything untoward with their information. We can use it to help them with the appointment, with the enrollment. We're not keeping anything. We're going to destroy any notes we take, but everything is about making sure they know that they are safe, their information is safe, and that we are exactly what we're representing ourselves as. They could take that consent away at any time. I don't think I've ever really had a consumer do that. Usually they want us to be able to access the information because that trust is developed fairly quickly. But the idea there is it does give them control over, hey, we're done talking. I have the ability to terminate this relationship at any time. Again, very uncommon with enrollment assistance work, but it is something that empowers the consumer, and that's good. Gathering information first, screening for options for enrollment. This is critical. This is huge. When you are doing enrollment assistance work, you're probably going to get in the habit of very quickly getting to the point of how many people are in the household, who has income, what are the tax relationships, things that you probably heard DHS and OCI talk about, especially DHS, for assessing things like Medicaid eligibility. But you want to gather that information because you don't want to be surprised when you're doing the actual application, right? You want you want to have all of the information about the household. So when you are going into the application, you're able to pick the right one, right? You've screened them, say, okay, there's no work insurance, your income is X. We should just go ahead and do a Badger Care application. You don't need healthcare.gov. Or, oh, you're definitely over limit for Badger Care. We're going into the healthcare.gov application and see what your tax credit's going to be. Or you have an offer of work insurance. Let's look at the affordability of it. All of these different pieces. You don't want to be surprised in the middle of the application. You want to be confident about the direction you're going before you even open it, before you go to a different website. For healthcare.gov, that includes the window shopping tool. We find that consumers, and this makes perfect sense, want to know how much it's going to cost, right? Before we ever do the application, they want to know, is this even a good use of my time to give you all this information and go through this process if it's not going to be affordable at the end? So the window shopping tool, which we can drop into the chat, although you'll see it a lot and probably have it brought up a lot during the conference, is healthcare.gov/C-plans. Will let you put in zip code, basic income information, household information, and get a general sense of what the premiums will be and the tax credits to reduce those premiums will be for that consumer, for their household in that area. And that it makes things so much easier because they have something to look forward to. Then they have some of their bigger fears allayed, their concerns are laid to rest, and they're active and eager to get through the application then because they know what they're looking for. You could save a lot of time looking at plans, figuring out what providers are important. Um, and then afterwards, the appointment follow-up is we're not done just because the appointment's over or even just because they enrolled. Things are still complicated. Consumers are still going to have questions. So making sure that, if I always tell consumers, if you don't remember anything else, remember that you have my phone number, my email address, and you can reach out to me anytime. And I'm going to get back to you. I'm going to help you with whatever comes up. There shouldn't be any surprises. I always tell consumers, if anything is different than what we talked about, I want you to reach out and tell me because again, we have that trust and it is kind of a sacred bond and we don't want to ever leave a consumer feeling like they don't have that support. That's the difference between working with an enrollment assistant and doing this on your own, which is confusing and overwhelming. And we're here to make that easier. So hopefully that all makes sense. I am going to push out the first poll question right now. Assuming I don't have any more technical difficulties, I would like to not. All right, let's go ahead and do that. So this is not this is based on your personal experience. Oh, you already got that? Okay, cool. It's based on your personal experience. So whether your professional experience, your own opinion, what do you think is the most common concern for a consumer seeking marketplace insurance? So there's no wrong answer here, but I'm really curious about the different experiences you've had with consumers through your work, through the different what walks of life you've been down, and figuring out what do you think is going to be the most important thing that comes up in that appointment, most important to that consumer. And we'll leave that up for a minute. I think we decided, and it does seem to be working now. I can only see percentages. I can't tell how many people have actually done it. All right. Interesting spread of answers there. Looks like a couple are still coming in. Elizabeth, is there anything interesting in the chat we should cover, or the Q&A before we dive into the application?
We have somebody that said that they can't see anything on the screen right now.
That's okay.
And excuse me. Someone is wondering, would you complete the application first without completing enrollment or use the window shopping tool? The window shopping tool seemed to make patients uninterested. Any tips on not scaring patients away regarding cost?
And that's a really good question. So with the window shopping tool, I have seen the phenomenon you're describing where it can scare people away. A lot of times I find that it scares them away when they try to do it on their own. I think a lot of the time that's because they don't necessarily know how best to represent their information, their household. They don't know exactly what it's asking, because it's not super clear. I think I would, if that bad experience is coming from them doing it on their own, I would sit down and do it with them just to be sure what they're seeing. It is entirely possible that they're doing it on their own and they have a very high income and what they see is not that favorable. If somebody if I have a good sense of their income level, and I've gathered all the information, and they don't need to see the window shopping tool, I mean, the consumer can say, "Hey, I don't want to waste time. Let's just get to it and see what's there." Or a lot of times, you'll have renewals, right? You'll have people come back to you, and you won't need to do the window shopping tool. So that's a really good question. You're going to find it's a little different depending on the different consumer, their preference. But you shouldn't. I think that's the core there of them being scared away is really interesting, and I think that that's something that sometimes we have to talk people past that fear or concern just to see what we see because they don't know and we don't know what we'll see. And also the answers in the window shopping tool can be slightly different than what actually what the application actually says. Anything else?
No, that's all we got right now.
Okay, cool. I am going to share. Do we share the results?
Yes.
Okay, they're being shared. Great. So premium plan cost is really interesting. That's what I think a lot of people generally feel out in the public, right, before they start working with us. I think a lot of the time, what I found fascinating doing this work for, I guess, it's been 8 years, which is kind of wild. Um, what the thing I see that they're more passionate about, that they're more is a greater concern to them once they've gotten past that concern over cost. Like they go, I need insurance. I don't know how much it's going to cost, but I know I need it and I need to pay for it. Most people come in, and the thing that is the deciding factor on picking plans tends to be that network, what providers they can see. They want to know they have a doctor, or their child has a doctor, or they have a condition they're managing, and then that seems to be an even greater determinant than the plan cost because people will when it comes to their finances, they will figure it out if it means seeing the doctor that they want, if it means um, having insurance they can actually use or feel comfortable using, because oftentimes there will be cheaper plans available. There will be bronze plans. There may be $0 plans, but if they can't see their doctor or can't see themselves using the insurance, well, then they've hit another barrier. All right, I'm going to now, we're going to go through the actual application, which means I'm going to actually share my healthcare.gov, which I'm going to need to exit out a couple times where things like, say, social security number come up. But I want you guys to see it, especially those of you who haven't done this before. All right. It's a little different. But you guys can, in theory, see that, and I can zoom in a little bit. I think that would probably be helpful. Zoom in on the right page, actually, would be good too. Okay, so you log into healthcare.gov. The login's pretty self-explanatory. I have a slide or two on it I can actually share, but it's not something we need to get hung up on now. You'll be able to see past applications. You'll see from mine here, this is literally this is my personal healthcare.gov account, but it's also one that I don't actually end up submitting the application on, because this is what I do when I want to walk other assisters through the process, through the application like we're doing today. And if I had submitted it with the information I typically put in it, it would be tantamount to fraud, assuming I enrolled in a plan or something like that. But basically, there is no test environment as there is in Access, which, if you haven't heard about, I'm sure DHS will talk about the Access training site, which is very useful for enrollment sisters to be able to play around. But when you go in, you'll get to, it'll say need health coverage now, and you can select your state, which would be obviously Wisconsin for us, and we'll start the application. And at the end of the year, you'll see it'll let you pick between 2024 and 2023, in this case, 2024 and 2025. And we're actually going to walk through. It says your identity has been verified. That is something that I wish I had a sample that I could walk through with you guys. It is a very interesting process, because identity verification is based on data sources, things that it can check from like credit history, typically is sort of the basis there. And you'll encounter very, very young consumers and consumers who are from other countries.
We are,
And
sorry, Adam, we are being told that nobody can see your screen share. Elena, I'm wondering if we can turn the screen share off and then try and bring it back to the main stage.
I see it on the main stage. Can you guys see it? Other presenters? Okay. Let's just run the whole gamut of technical issues, why don't we?
We never see anything. Oh, now people can see it. Aha.
Okay.
Yep. Can you go back a little bit?
I should be able to. All right. People say where it says need coverage now.
All right. Yep. Sounds like it's looking good.
All right. Well, hopefully I can spend enough time on each one in case there's a delay like that again. Not cool, but thank you guys for enduring with me. I appreciate it. So what I did was I selected Wisconsin, and I hit start application. And as I was saying, you'll see the past ones in there. Usually it'll say completed, because these might be people you've helped or who've actually enrolled before, versus me who's just using this kind of a test case. And what I was talking about here, your identity's been verified. The first time you go to do a marketplace application for, say, somebody who is brand new to healthcare.gov, it's going to ask them a series of questions. There will be typically like, hey, which of these cars have you owned, or in which of these streets did you live on, or which of these cities did you live on? Typically, there will be there'll be 4 questions. 2 or 3 of them you can answer very easily, or the consumer can answer very easily. Hey, which of these do you have a bank account through? But there will almost always, it's kind of funny, almost always the last one will be like, which of these phone numbers was previously yours? And that will always be none of the above. Like just as a little, if there was ever one that was there, I would be shocked. It would be a complete coincidence, because there is no database of phone numbers that the site is actually capable of pulling from. So that question is almost always filler, and it's always none of the above. So just a little insight into how that process works. What I was saying is the consumers you'll have trouble with is very young consumers. So say somebody who's 18, 19 and doesn't have a credit history, or people who are new to this country, or have been paid, say, under the table at previous with previous employers. They won't necessarily have a credit history, and that's you'll hit a snag. You'll be able to do and get past it and do most of the application, but it won't let you submit until you verify their identity. We won't go through that process now because I can't easily recreate it. But it does come up, and it is worth talking about in the future. And it involves contacting Experian and the marketplace, and kind of navigating a few different systems till they finally, might take a picture of their ID and say, okay, we found you enough to let you enroll in health insurance. There are some implications for that I will actually talk about during the special enrollment training on Friday as well. So the first thing they see is the privacy and use of your information. Now, you can read the screen verbatim to a consumer, or a really great way to do this work is if you can have the consumer walk themselves through the application. That's actually my preference, because then they get to experience it and take some ownership over their health coverage. But oftentimes, most often, they want us to walk through it. And that also means they don't typically want us to read it to them verbatim. So we will summarize, and you'll get very, very good at doing this. And for privacy and use of your information, I find that this comes up in a very timely fashion, because they'll have just gone through the identity proofing, and that means you have a perfect example to say, hey, agree to have your information used or free from data sources. That's exactly what they just did. They check things like income on the back end. They check things like credit history on the back end. Uh, More importantly is, hey, I'm providing true answers to the best of my ability. It might be for proof of special enrollment period, but really just letting them know that everything, they're giving their best available information. Um, it's very rare you'll find a consumer acting in bad faith. I don't even want to get into that. We'll assume for the sake of our demonstration today that the consumer's acting in good faith, but it can happen, but it is very rare. And you can reach out, or we'll cover that in maybe a complex case or complex training in the future, not for pre-licensing. So it's gonna say, hey, these screens I find distracting, because I'm imagining myself as a consumer going, okay, now I have a lot to look at and I don't really know what's super important here, when really you're trying to get to these green buttons. Now, the instinct as somebody who does this all the time is to not process the information and just keep going. But it is, again, I have to reiterate that it's a really good idea to put yourself in consumer shoes and slow down, right? You should think, okay, let's see what they see and think about it the way they think about it. Go ahead, go do application setup. That makes sense. They're going to collect this information. They're going to ask about life changes. That's for special enrollment periods and stuff, and then actually submit. Again, I don't find this super useful, but if it had things like, hey, this takes about 10 minutes. Hey, this takes about 15 minutes. This takes about 10 minutes. That would be useful, I think. The whole thing, the application, I think the baseline is probably about half an hour. We'll go through it faster today, focus on some things, not others. But with questions and with the full enrollment experience, you should be expecting to sit down with that consumer for at least an hour, if not more, to not rush things. Because if they have questions, you want to make sure you're doing those questions justice and answering them correctly. Application setup. They're going to collect some basic information about household, and I am, let's see here, going to probably stop sharing just so my social security number doesn't come up here. Although I think we're probably safe for another screen, but I want to be a little paranoid about this. Um, Elena, is that you? You got me? Is it, or did it? Okay. But application setup, the thing about application setup is the application doesn't really exist yet. It's not like you saw me exit out before and jump back in because it wasn't showing up. It doesn't really exist for a few more screens when the application number is signed. But here you'll say, I'm applying for coverage in Wisconsin. It'll say, how many people do you report in your tax return? And then it'll say, about how much income do you have? So for me, I have a household of 4 here at home, but I'm actually going to put 1 for the sake of this application. And then for the income level here, this is kind of their basic income. This is the litmus test for determining if tax credits are going to come into play. So 61,000 or less, that's going to be 400% of the FPL based on the number of people in the household. So that's dynamic. It'll change if you say 2, 3, etc. And typically, if somebody selects the first option hey, I make less than this. It's the most common populations we help are going to make under that. They want to check for all savings options. Even if they make more than that, you still should check for all savings options. It's going to ask more questions. It's going to ask you the income questions. If somebody's like, I make way more than that, I don't even want tax credits, I can afford health insurance. Well, in that case, you have a very rare consumer, which is totally fine. And you can get through the application a little faster because it won't ask those income questions. But that will work. So typically you're going to say, just you should have this information already from work with the consumer and select, I want to check for all the savings options. And let's see here. I'm just going to, let's see. Want to. Okay. And any questions right now, Elizabeth, or no? Other than the technical issues?
There's one person who's wondering where they would be able to find a great template for consumer consent forms to have them fill out before talking about their private health information.
Sure.
I believe we have some through CMS, so I am going to be looking for those and see if I can post a link.
Okay, cool. I mean, we have them too. I mean, they could see ours. Nothing wrong with that.
Okay, great.
Okay, so we'll check for all savings. I just did kind of a double check with some of my notes here just to make sure the social security number isn't going to come up. Although I was like, oh, you'll see my birthday. That's fine. So you'd say, I need coverage for myself. Is typically the case. You may be working with a more complex household where you have other people, and they'll say, no, I have coverage to work, but I do need it for my spouse, my child, etc. So that is what that question is asking. And the next things on here are all going to be about home address and things like that. And then it will ask about sex. It is an optional question. It is basically about demographics, and the female question does trigger pregnancy-related questions. I am going to stop sharing real quick just because I can put in a fake address, and I will. But either way, I do think my actual one is going to show up first. So I don't want to dox myself, I guess is what I'm saying. All right. I guess the sex actually is required as a required question. I did misspeak there. So there is my question or my address. I'm going to change that. So yeah, if you do have past applications in the system, it is going to pull information from those first. And that you may need to change that. I've had consumers where I need to change the address many, many times. And then for home address, it will actually ask you, it'll say, hey, is this the right mailing address? And it'll pull up the USPS record. You'll typically say yes, because it'll just add that extra postal code to it. And then it's going to ask for contact information, email address, phone number. You'll indicate, phone number of those is going to be, I think most people, it'll be a mobile phone, and then email address is required to actually do the application. So we often set up email addresses for people, and it'll be the same email address that all of their different notices, hey, we're sending you a notice, go to. And then once you indicate that, you've basically gotten to the end of the setup screen. And I'm just going to share the screen I have right now, just so you guys can see the preferred language here.
Adam, we have a couple of questions about the sexual identity and orientation questions. They're wondering if there is a cost difference depending on how you answer it, and what if they were born male or female but identify as another sex?
Sure. We actually haven't gotten to those questions yet.
Oh, sorry. I thought we did. Never mind.
That's okay. Because let's see. I did have a slide in them, and I think when I was setting it up, I did encounter them to actually cover them in detail. There's no cost difference, and that's really important, right? So with the Affordable Care Act, it's protecting people from all kinds of different cost differences, things like that. And what was the other question you said?
If they were born male or female but identify as another sex.
Sure. I would go to always double check the help text. Is a really good tip. I would go with how they identify and answer it that way. Because I mean that's really more important for the demographics that the healthcare.gov wants to collect, and really more important for, yeah, we haven't, I just double checked, we have not gotten to those yet. I was like, I don't think I skipped them. But the it's also more important for the different care and coverage that they need, right? Because that's what I find when I am working with transgender individuals, for example, that a lot of the different care and the providers they want are have to do with their gender assignment, the gender they want to be, the gender they have chosen and identify as, and there's a lot of medical questions that go in with that, right? So it I would say indicate the one that they identify as versus the one they were assigned at birth. It can get tricky with the identity verification, obviously, and you may need to navigate that. But I won't. We don't really have a good case study to go through right this second for that. So there are a lot of good questions tied into that, but we could easily lose a ton of time going through them.
Okay, perfect. Thank you.
Yep. Preferred language, you'll see the application ID has been generated, so now the application exists. With preferred language, you'll do preferred written language, preferred spoken language. These can be helpful because you can get, uh, the marketplace does have different language support and things like that. Not always the best and not always the easiest to get a hold of. So I have a little hesitation here. If they've got a navigator and you have the language covered, you already have a translator, great, you're already way ahead of the game. In terms of getting the written language, the only one that is really supported in terms of getting notices in that language is Spanish, right? So if you can actually do the whole site in Spanish, which is really interesting and cool. And I would defer to my Spanish speaking navigators to see how well it works and how well the explanations are. But I think the trick is that most of the education for assisters is in English. So there is a little bit of a disconnect between what consumers see and what you've learned as an assister in that case. But you can get the notices in Spanish, but they won't send them in just any language. Spanish is the one that is really supported. Um, Okay. So then you can do contact preferences. This is entirely up to the consumer. Email or text when there's new notice, or send me paper notices in the mail. Unfortunately, they are mutually exclusive, and you can't say both, which is a little frustrating. I've had a number of consumers frustrated by that particular piece. Um, but you can, these are all dynamic. So if you say, hey, I want paper notices, it does nothing. But you could say, hey, I want them emailed to here or text to here, and you can indicate different numbers. So that is helpful. I will say paper notices for now, and we'll save continue. Um, Application help. This is super important, especially for navigators. I do want navigators to listen to this. And this is you select, hey, yes, somebody is helping with the application, is a navigator, and you're going to indicate your first name, and your last name. You'll notice those aren't optional. These optional ones, like organization, are. But the most important thing by far is this application ID. This is how they actually track our progress for the Navigator grant. I don't think it's as important for CACs because they don't have the same deliverables assigned under the Navigator grant. But for navigators, the new ones on here listing right now, this is one of the most important things you do when you help a consumer. There will be instances where they'll already have done, a consumer will come to you with a completed application and you won't do this. But if you're helping a consumer and you do from anywhere near the beginning, you'll want to include this information. Great. And then it's going to ask about who needs coverage, and this will indicate the different people in the household. You can edit some of the different demographic answers, things like that. I am going to go ahead and push, Elena, can you push the second poll question? I think it's just an easy true false. Elizabeth, how are we doing on time?
We've got about 15 minutes left.
Okay. Okay, this is where it's going to ask me for social security number. I'm going to stop sharing. Okay, so most people indicated true, it looks like. But I would say for the true false aspect of it, it's a little bit tricky because the answer is going to be false. If your preferred language is Spanish, you can get the notices in that language. But a lot of languages are not supported yet. I know that they try to support more, but it is not guaranteed right now. And I see them oftentimes. You'll indicate a language, and they come in English anyway, and then you'll have consumers reaching out to you, which is fine. I mean, that's what we're here for. I'm going to stop sharing just because we're about to hit some of the tax filing information. So you're in the household section, and it's going to ask who's in the household and indicate whether or not they're single or married, whether or not they're filing a tax return, if they're claiming dependents. I feel a little okay rushing this because these are the same questions you'll see on applying for Medicaid in the different pre-licensing sections we've done before, right? Where it's, hey, when I'm talking about household, I'm talking about who is on that tax return. For the marketplace, it's even more important, where you'll indicate there can be tricky situations, especially around divorce and who's claiming the child this year versus next year, things like that. But the main questions are who's filing taxes, are they claiming dependents, and is anyone claiming them as dependent? And then it'll ask if anybody is the main caretaker of a child. That is another trigger question for transferring to Badger Care. It lets them know to look at the different income limits for Medicaid instead of just for Marketplace. But the different thing, I mean, every state's Medicaid program is different. And one reason I want to collect all that information early is I don't trust the transfers between the two systems, right? You'll see in the training that in theory, the two systems talk to each other, they transfer applications back and forth. If they're working with a navigator, they want to not be passed around, right? They want to get to the answer, and you should be able to give them the right answer. So household information, it'll also ask if somebody is an American Indian or Alaska Native. You'll learn in your federal training a lot of really interesting special enrollment periods around that. And they'll ask if they're currently incarcerated as well.
Adam, can you bring your screen back on, or are you still on
I will in
private
just a
information?
second.
Okay, nope, sounds
Yeah,
great.
so there's some private information there. And it's about to ask a social security number. I'm just a little paranoid about that.
Oh,
I prefer that
absolutely.
not to be out there.
That's great. I just wasn't sure if there was something that went weird again.
Sure. And it'll ask race and ethnicity, if somebody is Hispanic, Latino, or Spanish origin. It'll very clearly indicate these are optional. Somebody is, here we go. I will share this one here because these are the gender identity question one that I know people have a lot of questions on. Let's see. So this is where the questions come up, where they did actually have the language change where it says what was the sex assigned at birth versus gender identity. So you get both. So to the question earlier is you do actually now get both, which is good. Although these are optional. One of the most awkward things is, as a sister, is I mean they added these questions. They didn't even tell us they were coming, and it's really frustrating for a sister because it's like we have to talk to these consumers and suddenly I mean, especially your first few applications, we're suddenly asking them these questions. It's really important to set the consumer's mind at ease. Hey, these are optional. If this is important to you to answer and to share this, maybe this is an issue you're really passionate about. We want you to share that and feel it, but you all absolutely don't have to. You could tell a consumer, I don't even feel great having to ask them. They're on the application because CMS wants to collect demographic information about healthcare and health coverage. So it really comes down to just having a human moment with your consumer and letting them know, hey, these are on the application, but they don't impact eligibility or plan details, costs. I think that question came up. So they're very clearly now telegraphing that all of these are optional, which is great. All right. And then, yeah, social security number is going to come up here. So. All right. So the very next thing that comes up is social security number. Which they will have already provided when they do the identity proofing. And then also it'll ask if the name matches social security card. It usually will. Most people get them changed if they change their name or get married. It'll also give you the option to indicate if they don't have a social security number. So if they have an immigration status, it will open up all of those questions there. And so after that, you'll see, and I can share again, having indicated that. That's the one thing I can't fake, right? Is social security number. I don't know what kind of hard stop it will give me, but I imagine it will give me one. So they'll ask if you're a U.S. citizen or national. Again, you'll say yes. If you say no, it is going to generate a whole bunch of questions about immigration status. And there's some really great trainings. This is not that training to go over all the different statuses, but there's some help text. And then healthcare.gov, actually, the glossary has a bunch of information on the different statuses and the documentation you need to cover those. And we have an immigration training coming up. I think, Elizabeth, you said that at the beginning, didn't you?
Yes, yep, October 15th from 1 to 2:30.
Fantastic. Disabilities and help with activities. These questions, again, are basically Medicaid triggers, but they're ones I don't particularly trust as an enrollment assister. It'll ask if you have a special healthcare need, if you need help. So if something is limiting your ability to work, attend school, or take care of daily needs. And then if you actually, the next step up from that is if you need help with daily activities. And they have good examples here. But I find the help text, especially if one of these issues is cognitive, to be a little overwhelming here. And this could come up if somebody has Social Security disability insurance, so they're getting SSDI payments. But ideally, you'll have identified this early on in the process, right? You should not be surprised at this point by your consumer. You should have been exploring EBD Medicaid options, not letting the application, the healthcare.gov application, be your test or trigger for that. And then it'll say, did somebody have Badger Care that recently ended or will end soon? This is, I mean, you're going to see a lot of this, right? This is special enrollment 101 kind of, and then it'll say, did your coverage end within the last 60 days, essentially, or in this case, actually it's 90. And then is the coverage going to end between now and in 60 days from now? So this is going to be your special enrollment trigger, and we're going to talk a lot about special enrollment. So it'll indicate what the last day of coverage is. So I'm just going to say, yeah, sure, I've got coverage. It's going to end on October 31st. And then it'll generate some questions that we can answer. And then has income or household income or size change? We'll say no. And then for income, and this, I mean, we don't have a ton of time, so I want to this is really, really critical to how we communicate with consumers. And one of the most important things on here is how we collect income information. Again, I want you to ask income questions and get used to asking them early before you even open up the application, because you don't want to waste anybody's time. And that information is fundamental to how we do this work and what questions we answer, right? So for proof of those, it'll often ask for pay stubs or tax returns, bank statements, things like that. If you don't have all the information, you're going to have a conversation with the consumer and you're going to come up with the best estimate, right? Especially if it fluctuates. There are a few different ways to do this. So if you have income from September and it's from one job, you could just say, hey, I've got a job. Here's the employer. You say ABC company. And then I'll say, okay, I'm going to make $2,000 in September. And I'll just add that. You will be able to add expenses. So there'll be student loan interest, alimony, different contributions to different accounts that will be pre-tax, things like that. I find these uncommon. Usually this is kind of all about the income. But this used to be easier and more intuitive, I will say. You might have self-employment. You might say, hey, I'm a musician. I'm absolutely not, but that's okay. You can add that. The problem with this is that it's going to take this that I put in for September, and it's just going to multiply by 12. It is very, very not sophisticated, which is it can be very confusing. And the people we help, their income tends to fluctuate a lot. So you'll see them do that right here. And then one thing to know is that, okay, you can say, yeah, I think it's going to be that much, and that's great. And they'll use that number. But this question, this is super important here. The income will probably be different than this. So if you'll say, yes, it's hard to predict, and then it'll let you just override what you just came up with the yearly income that you have calculated while working with the consumer. So it's going to be, say, oh no, it's actually going to be lower. It's going to be not 330,000. And then, so it'll let you completely override that. And you can also do, let's say, self-employment. Let's see, I want to edit. And you can also edit the income, the job income. If you go in and do edit income estimate, it'll let you go. Actually, I get 500, and it's actually every 2 weeks, right? So you can actually get more fine-tuned, and it'll let you go, oh, okay, that's what the number is, not just 1,000. So you can use the tool, but you have to know not to just get pigeonholed into what it wants you to do and just multiply it out. And a lot of consumers are going to make those mistakes, right? So let's see. It's going to update, and then it'll let me proceed. And then again, I can just say, yeah, that's much better. See, I just made those quick modifications and it's much closer to what I said it would be. And again, this is the consumers might get nervous around this. This is their best guess, their best ability to predict this. And I'll say, yeah, okay, I think it'll be about that much. And you'll do that for each member of the household. I think we've got 5 minutes left. Is that right, Elizabeth?
Yep.
Okay. So I'm going to go through this fairly fast. It's going to ask coverage and changes. Are they currently enrolled in health coverage? And it'll say, hey, not if it's going to end this soon. So it's a little already not intuitive, right? It's completely different than, no, I have it. Oh, no, it's ending. So I would say no in that case. But I did say, yeah, I said it would end on October 31st. So I don't have health coverage. And health reimbursement arrangements, I actually wanted to go into more detail on this. I realized while prepping that I was going to need to do a whole separate session on this. It won't be a conference session, but I am going to do a short separate video on this because health reimbursement accounts and health reimbursement arrangements are where an employer can offer somebody kind of a pre-tax deduction to reduce their premiums for health insurance, and they can actually affect somebody's eligibility for tax credits, right? Because it'll change that affordability test. So that's really all I have time to get into now, and I will be putting out a whole separate presentation on this because I know it's not covered in enough detail, basically anywhere that I could find. I will say this, for most people, these questions, the answers are no, and I think about consumers not knowing this language, having not encountered it before, and they're going to struggle with it. But they're asking, hey, if you already have one, can you decline it if you haven't accepted it yet? And it really can affect that person's eligibility. But in terms of the work we do, it is rare. And then it'll ask about other forms of coverage. So coverage to a job, for example, I'll say no. Special enrollment eligibility. And then again, the health reimbursement arrangements, they come back, right? They want to know specifically about the start date and end date to see if it will affect their eligibility for coverage. So I do want to give that the time it really deserves. And then recent coverage changes. Now, this is all special enrollment period territory, right? Did you lose coverage recently? We'll talk a lot about special enrollment periods on Friday. And I'll say no, but it'll ask then, are you going to lose coverage? Or did you have any of these conditions? These will all be covered in the special enrollment period training. And then you'll actually get to see the whole application and then say continue, sign, and submit. And then it wants to ask these last questions that I'll just go over before we wrap up here is to make it easier to determine paying for coverage. The marketplace wants to look at income data, tax returns, things like that for the next 5 years. They'll send you a notice and you can opt out at any time. Most people just blindly agree to that, and that's fine. The marketplace, the federal government, they're going to look at information that they're going to look at anyway, right? Like they're going to see tax returns, things like that. If there's a discrepancy, they'll get a notification. This just makes it a little bit easier for them to do that. It's really, you can agree or disagree without affecting the eligibility. And you could say, don't renew me automatically. In theory, it's to renew you automatically. I have always found problems with those renewals. So I think people agree, but I want to renew them. I want to work with the consumer again anyway, regardless. This one is saying if they're also found to have Medicare coverage, the marketplace will end the marketplace plan coverage. Again, most people, and again, by the time you're at this point in the application, you know if that person is going to be eligible for Medicare. And you will end that, like you'll work with them on that transition. I will say often have the consumer agree to that. But I have never, ever in my 8 years of doing this work seen the marketplace coverage successfully automatically end that person's coverage. So don't count on these to do what they say they're doing. The most important thing the consumer I want them to walk away with is this question. This is what I want them to actually think about. And they're saying, hey, if anything changes, I know I can make those changes and call and report those changes to the marketplace. I know how to do that. And this is where I tell the consumer, hey, if anything changes, let me know, right? I will help you. Your navigator will help you. Let Covering Wisconsin or your organization know. Because if you're not sure, we will answer that question for you, right? It won't be like you're not alone in this. And then it'll just give the signature box, and ideally you'll have the consumer type that themselves, and then everything is true to the best of their knowledge, and you have completed the healthcare.gov application. All right.
Adam, there's a question about if someone is denied Badger Care and then they go through a marketplace application and are told they don't qualify because they qualify for Medicaid, what should the enrollment assister do?
So that's a really interesting one because we'll see that a lot, right? We'll see people get churned back and forth. That phenomenon is known as churn. You're going to want to do the calculations yourself, and you're going to want to be really sure, right? If you're saying they're eligible for Badger Care, ideally you'll work with the IM consortium. You'll call them. This will be a phone call, right? So not just another access application, and you'll see, hey, what are you seeing in your system? How can we fix this? What is tripping this up? Is there income that is being picked up from before? Is there income the consumer didn't know they had? Something is hanging it up on the system side of things, and you'll want an actual human being on the phone to help you figure out what that is.
Perfect. Thank you. All right.
And
So
on the federal side of things, we don't have time to get to it right now, but like you can actually make sure it doesn't get sent over to the market or the Medicaid side of things too. If you're sure on the other side, right? You're like, no, this is marketplace. You can go ahead with that process too.
okay, perfect. Awesome. So it looks like we hit noon. So we are going to be wrapping up for today. Thank you all for joining us for the first day of pre-licensing. We start again tomorrow at 8:30 in the morning. We will have presentations from Department of Health Services and the Office of the Commissioner of Insurance. I hope everyone has a great rest of their day. Thank you again.
Thanks, everybody.